the patient's heart rate is 210 beats per minute. And the worst thing you can do is to give a medication we usually use every day. So let's get into the case. You have a 36-year-old man. He has palpitations and he's had similar episodes before that's resolved on their own. Today, the heart rate of the patient is 210. The blood pressure is 130/70. You look at the ECG and the ECG shows you an irregular wide complex tachycardia. What is that? What is going on? The patient has developed Wolf-Parkinson-White syndrome with atrial fibrillation. We call it WPW. So now let's slow this down and let's break it down. Now, Wolf-Parkinson-White means the patient has an extra electrical pathway between the atrium, which is the upper chamber of the heart, and the ventricles, which is the lower chamber of the heart. Normally, electrical signals pass through what we call the AV node, which is the gatekeeper that slows impulses down before they reach the ventricle. But in Wolf-Parkinson-White, there is a shortcut. A shortcut has been created. If atrial fibrillation occurs, which is basically a chaotic electrical activity in the atrium, those impulses can bypass the AV node and they can race directly to the ventricle. Now, the ventricles can then start firing extremely fast. So what must you avoid? Any medication that blocks the AV node must be avoided. Beta blockers must be avoided. Calcium channel blockers must be avoided. Adenosine must be avoided. Amiodarone must also be avoided. Because if you block the AV node, what you are doing is that you are forcing all the impulses to go down that dangerous path which has been created, and that is even more dangerous for the patient, and that can generate something very bad for the patient. So what do you do in Wolf-Parkinson-White? Give you procainamide or synchronized cardioversion. So you have to remember that while you're preparing for your board exam in cardiology, blocking the wrong pathway can make the rhythm worse.